Olivia, thank you. Now, there are new concerns tonight among the very people caring for coronavirus patients in hospitals all across Ohio. 5 on your side, Chief Investigator Ron Regan is here now. Ron, nurses say they want some answers.
Well, that's right, Rob. Nurses are telling me they will do whatever it takes to protect patients. But as that virus spreads, there are questions ranging from protocol to protecting nurses from getting sick.
Having enough protective equipment for the nurses to properly care for their patients.
Protective equipment like gloves, masks, and gowns. Nurses Association President Deborah Arms.
And we know that there's a limited supply of this right now. And so we at ONA are very concerned that when this virus peaks, that we have enough of this equipment for our nurses to take care of our patients properly.
And there are reports some is going missing.
We know that there's some hoarding going on. We know that there's some stealing of masks going on.
And nurses say there are still questions regarding protocol.
How many tests they have, what's their policy on testing people that present in the ER, what's their policy on quarantine if nurses get exposed.
And if exposed, what happens next?
And the nurse gets exposed and has to be quarantined for 14 days. Who's going to take the place of that nurse to care for that patient? That's where you have a problem with danger to the patient.
And there are questions whether nurses can call in sick without fear of or retaliation about losing their jobs. But we also have learned tonight that Ohio is asking the federal government for access to its emergency supplies of protective equipment. I'm Chief Investigator Ron Regan.